Disappointed. Very disappointed. I don't think it's dead, no, but I'm certainly disappointed. For 7 years I've been hearing repeal and replace from Congress, and I've been hearing it loud and strong, and then when we finally get a chance to repeal and replace, they don't take advantage of it, so that's disappointing. Let Obamacare fail, and then everybody's going to have to come together and fix it and come up with a new plan, and a plan that's really good for the people with much lower premiums, much lower costs, and much better protection.
Inaction is not an option. Congress needs to step up, Congress needs to do their job, and Congress needs to do their job now.
Sometime in the near future, we'll have a vote on repealing Obamacare, essentially the same vote that we had in 2015. I would remind everyone that in that proposal, there's a 2-year delay. A 2-year delay, which would give us the opportunity to work out a complete replacement on a bipartisan basis with our Democratic friends.
When you go back home, there's not much support for this bill. I haven't had one person come up to me and say, let's vote for the McConnell bill. At the end, I'd like to see a bill that people actually liked. I gotta go.
What do we want? Health care! When do we want it? Now! What do we want? Health care! When do we want it? Now! What do we want? Health care! When do we want it? Now!
We'd like to see the Senate move on something. We are proud of the bill that we passed. We passed a bill to repeal and replace Obamacare, to replace it with a better system. But as you well know, the legislative process, for it to work, House has to pass a bill. We've done that. The Senate's got to pass a bill for us to even move the process forward. That's the next step.
We Democrats believe that the time has finally come for our Republican colleagues to take us up on our offer of working together to improve the health care system rather than sabotage it.
The repeal and the other actions that the Senate are talking about could take us up to 32 million people losing their access to health care and health insurance. Really a monstrosity.